Here you can see the number of HCCs increased to 115 with version 28 as compared to 86 in version 24. There is greater focus on chronic conditions within version 28. Severe persistent asthma is an example. It was not an HCC in version 24, but is now one in version 28. Even if a condition remained an HCC in version 28, the numeric identifier and the risk adjustment factor, which reflects some severity, may have changed, as you can see here on the slide, for code Z68.42, the body mass index.
June, can I jump in for a second real quick?
By all means.
That risk adjustment factor is an important indicator. And what we're saying is if a patient was completely healthy, it's a multiplier, if you will, of how much money you receive. I can't tell you what that exactly is, but it is a multiplier. So a normal healthy person with no medical conditions would be thought of as a 1.000. As you add risk adjustment factors, this patient would be a 1.818. So it's additive to what their baseline state would be if they were healthy, and therefore multiplying the amount of money you would get in that risk adjustment payment. I just wanted to point that out, June. Thanks.
No, it's great. Thank you for that. Other changes include removal of certain conditions from the HCC classification, such as angina pectoris. And these changes highlight the complexity of the difference between the two versions and the importance of having systems in place to help manage the change. The need for coding specificity remains, just as we were talking about with the different risk adjustment factors and their addition cumulatives. Just as ICD-10 CM changes, so does the specific codes within those HCC categories.